Good morning, everyone. I am Dr. Kedar. Presently, I am with Ankura Hospitals as a senior consultant pediatrician, allergist, and asthma specialist in both adults and pediatrics, as well as infectious disease specialist. Today, I would be speaking a little about dengue again because with the onset of these raids, we are seeing more dengue patients in this season. సో నేను మీకు చెప్పదలిచింది ఏంటంటే రెండు రకాల డెంగ్యూ ఇన్ఫెక్షన్స్ని చాలా కామన్గా చూస్తున్నాం. వీఆర్ సీయింగ్ టూ టైప్స్ ఆఫ్ డెంగూస్ అండ్ డెంగ్యూ లైక్ ఇల్నెసెస్. యూ షుడ్ నో ద డిఫరెన్స్ బిట్వీన్ డెంగ్యూ and dengue like illness. Both have a similar presentation. Dengue fever usually has a high grade fever along with bone pains within the first 5 days, and later on they develop rash. And on investigation, we find that dengue test is positive. We usually go for the test which is called as ELISA, which becomes positive. These are classical dengues. Other group of dengue is with a similar clinical presentation with high grade fevers, bone pains, lethargy and generalized weakness with the onset of rash after the 4th or 5th day. But surprising fact is the dengue test is not positive. These are called as dengue-like illnesses. They are also some sort of viral infections which are similar to dengue in their structure and cause a clinical symptoms which are similar to dengue. So we should differentiate between dengue fever and dengue-like fever, dengue and dengue-like illness. So both have the similar clinical presentation and symptoms, and also the complication rate are also more if the platelets drop. Here, what we are seeing these days is the typical dengue fevers with the dengue positive investigations are not having a very bad course. They're not getting admitted to the hospital much. Whereas dengue-like illnesses which are having negative dengue test with a clinical profile matching that of dengue and having low platelet count, they are falling more sick, their BPs are falling, as well as all the other complications related to dengue are being seen very frequently in this subset of the population. So please be careful and see that even if it is dengue negative, but the platelet counts, BP, urine output and other parameters of dengue complications are evaluated properly before we take a conclusive step on dengue or dengue-like illness. Thank you.